Hi, I'm Dawn Fleming, host of the Midlife in Paradise channel. Thank you for being here. I put this video series together to answer the most common questions that we've received about moving overseas. In 2008, we were devastated by the financial crash, and I explained how that all came about and what we did afterward in this video. After we had recovered, in 2016, we invested in real estate in Mexico. We had no intention of moving there, but a year later, we thought, why not? We had a business, we could work from anywhere. So we jumped on our sailboat and went down to see if we liked it. If we liked it, we'd stay. If we didn't, we'd go somewhere else. And we did like it, so we stayed. Over the years, I've gotten lots of questions. I answered many of them in my book, Claim Your Dream Life, How to Retire in Paradise on a Shoestring Budget. There's a link in the description. I've also prepared a document, The Ultimate Insider's Guide to Starting Your Overseas Retirement. It answers the most common questions that I get about moving overseas. I've created a series of videos, and you can get the answers to each individual question just by watching a quick video. But if you want the comprehensive document, there's a link in the description. Can I find good healthcare services or get insurance? Answer: when considering a move overseas, many people want to know about healthcare, and the majority want information about cost, coverage, and pre-existing conditions. The United States is an outlier, spending a whopping 18% of GDP on healthcare consumption. On average, other developed nations spend about half that amount. A Kaiser Family Foundation survey found insurance premiums in the USA have increased over 55% in the last 10 years. The USA ranks number one in per capita spending on healthcare, yet it stands at only number 37 globally in quality of care. Unfortunately, the US healthcare system is broken, and Americans do not get what they pay for. Sad, but true. The truth is, there are better healthcare systems in the world that cost far less and deliver far superior care than the United States. It is utterly shocking to think about how much people pay for health insurance in the US, a cost that continues to increase dramatically. It's amazing how many times we hear stories about insurance companies refusing to pay medical bills when you submit them, or patients who believe something is covered and then get surprised by unexpected bills. The US healthcare system is unlikely to change anytime soon, regardless of which political party gets elected. There are just too many entrenched interests in the US focused on maximizing profits over people. It is a sickness system. It is not a wellness system. In many other countries, more resources are invested in preventive care. Of course, if you prevent illness, medical providers can't bill as much, which reduces corporate profits. That is the reality of the US healthcare system, and why it has not and may not be reformed. While Medicare Part A and B, often referred to as Original Medicare, do not cover you while outside the United States, you can get coverage through Part C Advantage plans. These plans often have zero premiums and cover emergency and urgent care medical services. In order to qualify, you must have Medicare Part A and B plus an address in the United States registered with Medicare. The address will determine your service area and need not be the same address as what is on file with the IRS. It may be prudent to use an address close to loved ones, so if you need to return to the US for medical care, you have some local support.